All right. Hello, everyone. Happy Monday. I know it's been a while since I actually have done a live Facebook uh, informational session. Normally now I'm doing it on my YouTube channel. So I'm recording the interviews and having them stored in that one place so you can go and look at the interviews that I'm doing with other people in the community, but also different informational topics that are helpful to the clients that we see. For those of you who do not know me, I am Dr. Monica Tillett. I'm a doctor of physical therapy, and I'm the owner of New Direction Rehabilitation and Wellness. And we're a mobile physical therapy clinic, and we offer speech therapy services and have recently added occupational therapy services. And our goal is to just help seniors age well, and aging well encompasses so many things. It's not just a physical health, but it's emotional health and all of that. And although we provide the physical health, we refer to community resources who help with those other areas of wellness. And one of the areas that I want to talk about today is the importance of a home exercise program. Because so many times we're going into the patient's home, we're seeing them for therapy, whether it's 2 times a week, 3 times a week, whatever is appropriate for that patient. And then, they just wait for us to come back and do the exercises again. And I know as a physical therapist, I know this is not just something that I see. I know that it's something that all therapists see across the board. And so I wanted to shed some light on why we as therapists give our clients home exercise programs to do. And the first thing, and honestly, in our clients tends to be the most important thing, and that is it helps you progress to your goals faster. So if we're coming 2 times a week, and we're doing different exercises, it's going to take us longer to get you to where you want to be if you're not doing the home exercise program in between time, because it's only going to take anywhere from 48 to 72 hours for the work and the progress that we made during that session to start going backwards. So that's why it's so important to maintain that progress with the home exercise program. The second thing that makes it so important is it gives the clients a role in their care. People do better, they're more successful, they're more motivated when they have a responsibility in whatever activity it is. So just like, growing up, when I got my first car, I worked a job to help pay for that car, and it made me want to take care of that car better. Same thing with the home exercise program. If you are doing this, it's going to help you take more responsibility and have more motivation to achieve your goals in physical therapy. And so, or occupational therapy or speech therapy, whatever it may be. So giving you a piece of responsibility is key in promoting positive habits in the future. The third thing that a home exercise program does is it promotes a long-term carryover. So you are starting to get in the routine of doing some type of activity or exercise during the week without me or another therapist being there to prompt you to do the exercise. And what that does is when therapy is over, you are comfortable continuing on with the exercises that have been prescribed. And that is going to help you maintain your progress longer. So with those 3 benefits, of course, there comes 3 downfalls of not performing your home exercise program. And the first one is it's going to take you longer to meet your goals, because when we come back, it's like we're going to be starting over again with what we covered in the last session, instead of building upon what you've gained in your home exercise program. The second thing is it's not going to stir motivation in you. If you're not doing your home exercise program, then you're not really seeing the value in getting stronger and improving your independence and improving your function. It's taking someone else to motivate you to do that. And so without you being motivated to do it yourself, then it's not going to work as well. And then the last thing is it's going to be a revolving door. Like I said not too long ago, it takes 48 to 72 hours for the progress that we've made and worked on to start going backwards. And so if we discharge therapy and you have not already gotten in that routine of doing a home exercise program, then that means that you're going to start that decline process faster, and you're going to be right back in therapy. And most people don't want to see us for a long period of time. There are some people who do, and those are the people who sign up for our wellness programs, and they want us to come and continue to coach them. And that's great, because they do see the value of continuing exercises once you meet your goal. They see the value of maintaining that progress. So whether or not you're doing your home exercise program, or you have signed up for a wellness program for us to come and continue to help you maintain your progress, both of those are important factors in your overall health, in your overall independence, and of course, aging well. So if you, are having problems, whether or not it's with getting in and out of the bed or getting out of the chair, or you're having a lot of pain, or maybe you notice your balance is more unsteady than it used to be, then give us a call. We will be more than happy to come out and do an assessment with you and get you on an individualized program to meet the goals that you are telling us that you want to meet, because it is patient-centered care. And so for those of you who are just joining, just want to remind everyone that every Monday at 5:30, I may not be doing a live on Facebook. What I have been doing is I've switched to my YouTube channel. I pre-record the informational sessions or the interviews, and I post a link for you to watch it. So make sure you subscribe to the YouTube channel. That way you can stay up to date and go in and see, all that's there as far as informational purposes. And again, we are physical therapy, speech therapy, and now occupational therapy services to help our clients. And that includes aquatic therapy. So again, thank you so much for joining me, and have a great rest of your week.